I'm back. It was recording. So, December 2022, by the first week of December, I was sitting down here at my home. My doctor had been going over with me how I had high cholesterol and different things. And over the years, I take cholesterol medication. And then I wouldn't because of some of the side effects. I had a heart attack. I sat here, and I thought, I'm having a heart attack. I looked up all the symptoms and I thought, I'm having a heart attack. So I had a heart attack. I didn't tell anybody for about 5 days afterwards. And on December 20th, when I was supposed to go to the doctor, my appointment got canceled. They had to cancel. Well, I called him and I said, my blood pressure is running 200 and something over 100 something. I'm having really bad issues. They put me on, and I said I'm having an angina attack. He said, well, for that, you need to go to the emergency room. I got an emergency room down literally, you go to the emergency room right here if you want to die, because it's not a good hospital. So I took the blood pressure medication, got another appointment in January, told him I thought I'd had a heart attack. I said, and he's just kind of going, you know, blah, 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 blah. I said, look, we got to do something about this. I have a horrendous family history. He said, remind me of your family history. I told him, he goes, okay. We're going to do something called cardiac calcium score. It's a CAT scan. They come up with a score, and it predicts your likelihood of coronary artery disease. My score came back bad. It came back that I was in the 98th percentile, meaning that only 2% of people my age and being female had a worse score than I did. So then I was sent to a cardiologist who wanted to do a chemical stress test, who then decided by the time I got home from that appointment, no, I've looked at your family history, I've looked at your EKG, you need a cardiac cath, which is where they go through the groin, or through your wrist, up into your heart, and they look at a monitor at all your heart arteries to see if they're clogged. Very quickly came out of that one with 2 arteries 95% blocked, 1 artery on the back side that they couldn't tell how blocked it was, and 1 100%, and definitely knew that I had a heart attack. So I go see another cardiologist surgeon. Says, we can't put stents in. Well, we could. I have to give you that option. But they would close back up. You need a quadruple bypass. So I opted for the bypass. I had it last week. I had a terrible experience at the hospital having it. I had written down in my medical records the medicine I was allergic to. They made the decision to give me medication I was allergic to repeatedly in the hospital. And I don't remember a lot of my hospital stay. Every surgery that I've ever had, and in between this time, I was diagnosed with calcified tendonitis on my femur bone, calcified tendonitis in both my shoulders, bursitis, torn rotator cuff. My gallbladder was full of cholesterol and had to come out. I had a goiter in my thyroid when it was wrapped around my vocal cords. So all this other things came out. Every surgery I've ever had, I remember going to the operating room. This one I don't. I don't remember coming out. I don't remember a lot of it because they were giving me medication that I was allergic to. I asked the nurse, what are you giving me? Narco. Okay, what's the other name for narco? Hydrocodone. I said, I can't have that. I am allergic to hydrocodone. I'm allergic to hydromorphine. I'm allergic to Tylenol 3. I'm allergic to oxycodone. They were giving me all 3 of those. And they wouldn't listen to me. It was even in my files. I was having massive hallucinations. I wasn't even sure if I'd really had open heart surgery. When my mom brought me home There was pink clouds falling, pink trees, falling from the sky. I was so dang sick, I wanted to puke. I thought my mom was trying to kill me. It was a mess. And I even called them back and complained about it. I don't know, nothing. I haven't done a checkup. I don't do my checkup until, I do a 6-week checkup. I'm only 1 week out. But after the surgery, my mom said that the cardiologist told her, after opening me up, that I was much older on my insides than my outside age. So my actual age is 47, but I'm way, way older than a 47-year-old on the inside. And looking back, I think doctors have a lot of responsibility here for misdiagnosing me, for not being attentive to my needs. And I'm basically always used to kind of tell people I was born old, because I always felt old. And it's not something that's unusual, because they told my dad when he was in his 30s that he had a heart of an 80-year-old. This surgery that I just had puts 15 years on my life. I could never have open heart surgery again or do stents. I'm not going to listen to him about the 15 years. That's in God's hands. That's His domain, not a doctor's. He got me through the heart surgery. Right now, what I'm experiencing, and they're not listening to me, is I have a lot of drainage from my wounds, and they appear to be infected. I've sent them pictures, and they say they're not. But that's my story. And I just wanted to tell it, to say, advocate for yourself. Stick up for yourself, whether you have insurance or not. Research everything yourself. And I had very good research, because my mom researched everything when my dad had his first heart attack. And doctors will get on to you about being, internet doctors. But you've got to keep yourself informed. So take care of yourself. Advocate for yourself, so you don't end up like this. And I always used to think I was born 40, because 40 was always the age everybody thought you turned old. So I'm about 87 now. So, but like I said, that's in God's hands. So take care of yourself. Advocate for yourself. And I'm going to go take some Tylenol, because I'm in pain. And thanks for listening to me. Bye.